Right. Hello, everybody. Uh, Welcome. Thank you for coming. Thank you for coming to the first of our webinar series. My name's Robin. I work for the Centre for Emotional Health. Hi, Charlie. And I lead the impact and research team here. This is my colleague Rowan.
Hi, yeah, I'm Rowan, Rowan Smith. I'm the Director of Training here at the Centre for Emotional Health, and I oversee all of the training that we offer.
So we are here today to talk about what well-being in the workplace means. Discuss some of the evidence around that exists around what works for mental well-being in the workplace, what mental well-being even is, our understanding of emotional health, and talk through the kind of approach and skills-based methods that we use to think about that. So we'll walk you through a few slides. There may be quite a lot of talking from both of us as we go along. I'll hand over to. So this is our plan for the session.
Great, yeah. So we're going to be about 45 minutes in total, and going to be covering those areas. So exploring what emotional health is, and having a little bit of a think about how it differs from mental health. Then answering the question of the webinar title, and particularly thinking about actually what actually is an evidence base, what's known to work, and why is it so hard to evidence this sort of stuff. Then we'll be talking a bit more about our particular approach to evaluating it in the workplace. Then ending before we have a bit of a Q&A session at the end around some information about how we as the Centre for Emotional Health support workplaces. There will be, as we go through, one or two points of interaction where we might ask anyone to offer us their thoughts on things, and we might also pause a bit for people to just have some time to reflect. Plus, also in between part along as we go along the slides, Robin and I, as well as talking to the slides, we might be doing a bit of chatting because that's what we're prone to do sometimes. Yeah, that's the content.
And if it's lunchtime, if your intention is to eat your lunch and zone out a little bit, I guess the main thing that we want to get across, the main thing that we want people to take away from this is that the answer to the question really is because it's really difficult and because none of us, I think, are quite settled on what it is that we should be measuring. And we'll speak much more about that as we go along. We are recording the session, so if your camera's off, your face won't be on. But if your camera comes on, your face may be recorded, and we'll circulate the recording afterwards. And I think that's it.
Yeah, I think so. Great. So just a bit about who we are. Some of you may be familiar with us, some of you may not. We are the Centre for Emotional Health, and we have been around for 28 years. And for most of that time, we were called Family Links, and we changed our name to the Centre for Emotional Health about a year and 4 months or so ago. And one of the very main reasons why we changed our name is to do with that first point on that slide, which is about our vision. Our vision being for everyone to live an emotionally healthy life, and very much felt that although emotional health has always been a really core part of everything that we've ever done, actually the name was quite restrictive in terms of broadening out beyond families really, and children and parents. So it felt that the Centre for Emotional Health was a really great way to enable us to achieve our vision. Bit about what emotional health is. So it's very much that set of skills and beliefs that we all have that shape the way that we think, the way that we feel, and the way that we behave. And it's very much affected by the relationships that we have throughout our lives, and also the relationships that we observe for those around us, particularly those who are closest around us. And I guess it's particularly there's something about good emotional health, as it says on the slide, very much about being aware of and understanding and being able to manage the range of emotions and feelings that we have. But it's also, I guess, very much around being able to manage the ups and downs of everyday life, and particularly as we're talking about workplace today, in that context, about the ups and downs of everyday life at work.
Mm-hmm.
just a little bit of information about the differences between emotional and mental health. So there's just some very brief bullet points on there. And this is just a flavour. These aren't all of the differences, and there's a lot more that we could go into around all of these. But these are some just for quite generalised points that help people often to differentiate between the two. But we're very much aware that mental health is a term that very many people are now incredibly familiar with in a way that they probably weren't 10 or 15 years ago. And emotional health is probably not the case, and that's certainly part of our mission, is to raise awareness much more of what emotional health actually is. So for us, some of the key differences are emotional health is universal. It applies to everybody, whoever you are, in whatever context you are. Mental health interventions tend to be targeted, and they tend to be targeted towards those people who either have a mental health illness or who have been identified at risk of having a mental health illness. Another key difference is emotional health very much focuses on people's strengths and people's assets, and we'll talk about assets a bit more when we look at our specific model. Whereas again, mental health interventions tend to focus on deficits, where there are problems, where there are gaps, or where they're perceived to be weaknesses, or where there are things going wrong. That's often when mental health interventions come into place. Emotional health, as the name implies, focuses very much on feelings and emotions. And although mental health does do some of that in that social emotional areas, there's a lot more around focusing on neurology and cognition in mental health than there is in emotional health. And again, a very broad difference in that final one is that emotional health is very much around relationships and how they impact on us. A lot of mental health interventions tend to very much focus on that individual and how that individual is. So some broad brush differences there.
Yeah. Yeah, and there are a lot of definitions of mental health that vary wildly, very clinical, to ones that are so broad that they encompass our definition of emotional health.
Yeah,
But I think
absolutely.
it's quite helpful to separate them out for this kind of thing where you're thinking about what kind of skills are important, how do you support people in their
Yeah.
emotional health. It's helpful to kind of separate those two definitions.
Definitely. And going back to that point around the different definitions of mental health, it's really interesting. If you look at some of the key organizations nationally who work in the field of mental health and look at their definitions, they are very different actually. So there is even amongst mental health, there is no single agreed definition.
Yeah. I think even the definition for mind, it ends up being a page long.
Yeah.
It's so difficult to explain.
So I mentioned strengths and assets. On the right hand side of this slide, this is a diagram of our model of emotional health, and lots of individual assets there. They're all important in their own right. The interaction between each of them is equally important. And it's worth just looking at this, how we frame this. So if you have a look at this, you'll see that vertically there are two columns. So there's the self on the left hand side and the others on the right hand side. So how that applies interpersonally on the left and intrapersonally on the right. But also we've got three columns there. We've got awareness, beliefs, and management. And what I'm going to do is I'll just very briefly go through each of those, and I'm going to then ask you to be thinking about a potential concrete example of each of those assets, particularly in the workplace. So if you're familiar, you might be familiar with this model, so it might be helpful to think of it specifically in the workplace. So I'll talk through first, then I'll just invite people to come up with suggestions. And if you are going to say something, it'd be really helpful, obviously, to unmute, but also it'd be lovely if you're able to turn your camera on so that we can see. But obviously, if you feel uncomfortable doing that, don't feel that you have to. So I'm going to work on that top row first, awareness. So self-awareness, probably a lot of people familiar with that idea of the extent to which we know ourselves, what makes us tick, what triggers us, in which areas do we feel comfortable with, when do we feel happy to stretch ourselves, all those areas where generally the feeling is that the more we know about ourselves, the more we understand how we tick, the more helpful that tends to be. And the other side of that, the way that that reflects on with other people, is the social awareness. So there's something there very much about actually our awareness of the impact that we have on other people. So that might just be our words, it might be our behavior, it might be our presence in some way. And then going along that middle row, first one's the self bit, self beliefs. So just want to stress that that is self beliefs, not self belief, as in, yeah, I can do it today, that sort of thing. It's self beliefs. It's actually the things that we hold to be true about ourselves. So probably something about our identity, for example. Do we think that we're a good person? Do we think that we're a trustworthy person? Do we think that we're a person who's worthy of being liked and admired? Or the opposite of that? Do we think that is our belief that we've not got much to offer? Where do we fit in the world? All of those things that we believe about ourselves. And I'm just going to skip over one to go to the beliefs about others on the right hand side before we go to the middle one. So yeah, what do we believe about other people? Do we generally believe that other people are to be trusted, that other people can do things, or do we believe that other people, are people who we need to be a bit suspicious of, who aren't good at doing things? What do we believe about other people? And then that middle one, which is a really crucial one, is self-agency. So the extent to which we feel that we have got control and autonomy and power over our own lives. So do we feel that we've got some say in that, or do we feel that actually things happen to us and we really can't do much about them? You might know in your own lives, some people who are often talk about, oh, it's unfair, this always happens to me, and people sometimes give off a sense that there's nothing that they can do about that. And particularly people if they've had a lifetime of actually being disempowered and actually not being given much power, often leads to having a sense of little self-agency. But really crucial, the extent to which we can feel that we can make changes to our own life if we need to. So as I'm saying through these, just be thinking about those potential concrete examples of what it might look like in the workplace, which I'm going to invite you to think about in a second. Self-regulation, probably most of you are familiar with that idea to which we're able to feel that we're able to control our own emotions and to check ourselves when we need to, and to manage our emotions in a way that's both good for us and good for other people. And then probably needs no explanation, relationship skills. Again, how all of that pans out in the way that we interact with other people, and how effective are we, how flexible are we, how all of those dynamics work. So that's our model. I hope that's been really helpful. Just before I do that sharing bit next, just want to look at that left-hand bullet point, which is really key for us, is that the bottom one around the role that good emotional health can play in being a potential protective factor against mental ill health a bit further down the line. So that feels particularly relevant in lots of areas, but specifically in our workplace work, it feels as though it's quite important, and I'll talk about a bit about that later on. But let's have a look at each of those assets then, and see if any of you folks have got any thoughts on what a concrete example of that might look like in the workplace. So self-awareness, maybe I'll kick us off. Self-awareness, for example, might be something like, I'm going into a meeting and I'm aware enough to know that I don't know much about this subject and other people are more expert than I do. Or I might go into a meeting and I might think, actually, I've dominated this. I haven't let other people have space yet. So just that awareness of ourselves. So let's move on to social awareness. So again, reminder, that's about the impact that we have on other people. Anyone got a concrete example of what that might look like in the workplace?
Hi there.
Hi.
I break the silence. Um, yeah, actually, just following on from the example you gave, actually, it's when you are in a meeting and you have an awareness of your impact on others in terms of what you say. It might be to do with the hierarchy of the organization, or yeah, just how you are in a group of people, and it might be that you do allow for others to speak or not.
Great. Thank you ever so much, Fran. Um, let's move on to the next one. So self-beliefs. What about, yeah, the beliefs that we hold about ourselves? Any examples of what that might look like at work for us?
I think perhaps the belief that you are competent and able to do the job is sort of quite important for a lot of jobs where confidence plays a key factor in your ability to undertake the role.
Yeah, absolutely. Yeah, great, thank you. And I guess in some ways that maybe slightly follows on with the next one, with self-agency, really. But again, it's our belief about our own confidence levels and everything. If that's probably going to impact quite a lot on our sense of self-agency. We often call it personal power, the extent to which we feel that we can make changes. So maybe let's move on to the next one. Anyone got any examples of beliefs about others? What we think about other people in the workplace?
Shall I give an example?
Yeah, great.
I think a good one of this is like being able to delegate. For me, to have trust that somebody else is competent and dedicated and understands the importance of something as much as I do. And being able to like let go a bit and say like, yep, you deal with this.
Yeah, absolutely. Yeah, great example. Fran.
Yeah, can I just ask a question? Because I was just interested that the self-agency kind of sits across that dividing line between self and others, and was curious to know why that sat there, because you can see kind of the interface of the other two things, and I don't know, just any comments on the extent to which that sort of like sits in both realms?
Sure, I think it's part two reasons. Is that first reason, I think it's because it's right at the heart of everything. It feels so central to everything that it feels as though it needs to be across both those strands, and also our self-agency has such a big impact both on ourselves and crucially on other people all the time in our interactions with the world, really, which is why it feels as though of all of those it is the one that, although it stems from ourselves, it has huge impact on other people as well.
Thank you.
So let's move on to self-regulation. I'm sure probably, if we're all being honest, there are probably lots of times when we might have felt the need to sometimes, I've got to check myself or I'll hold back on that. Has anyone got any examples of that?
I mean, not emailing people and telling them to piss off when they've said something rude to you.
Yeah, exactly. Yeah. Just a really good practical example. Just checking yourself before you actually do. Stopping for a while and thinking, hold on,
I'll reply tomorrow.
Yeah. Is it going to be helpful if I say that straight away, or do I just need to think about what the consequences might be? Really good example. And the relationship skills we probably don't need to go to. You know, we most of us work in teams of different people, and we might work with customers and service users. We need to use a range of relationship skills, and we're probably all much more sophisticated at that than we realise we are, because we tailor our interactions.
Yeah, but that email example is a nice one where, you know, the self-regulation is not sending the email because it's not going to help you, but the other side of it is, you know, is this email I'm going to send actually going to help the other person?
Yeah.
You know,
yeah.
It's going to make them feel worse,
completely
disempowered. Then actually, it's an example of poor relationship skills.
And it also highlights, I think, the interaction between those different assets, because I'm immediately also thinking that it relates to that social awareness bit as well, about the impact that what we do has on other people. Great. Should we move on to the next slide?
Yeah. So this is a bit of an extract from a report that we've been involved in writing with the University of Cambridge. That I think it helps to draw the line between those assets and what it means in a workplace. That I think it's easy to it's sometimes easy to kind of access what it feels like to be at work and be under pressure and things, but it can be quite difficult to, I think, appreciate what those skills, good emotional health skills, can contribute to, you know, a more efficient and a more productive workplace. And I think there are, you know, when you give it consideration, there are examples like, you know, good customer service requires somebody to have good relational skills, and certainly requires people to have good self-regulation of not saying something that they shouldn't.
Yeah.
But I think it's more than that. It's, it's being creative and having that self-agency. There's those self-beliefs that you are like a person who can contribute to some project that you're developing.
Yeah.
And I think the other side of that, is, and thinking about the differences between mental health and emotional health, that we are all used to that language of work is a thing that causes stress and poor mental health, and that the thing that we should do is to find ways to break that connection between work causing poor stress and poor mental health. And actually, there's an entirely different way to think about it, which is that actually work is something that can contribute to the building of skills, emotional health, beliefs about yourself, self-agency. I think there's a positive impact that we just don't really talk about. It just isn't kind of part of that common dialogue as much. I know that's particularly true for, I get a lot of self-agency. I get a lot of benefit from feeling productive at work.
Yeah.
And that's something that actually is a driver, and it isn't a source of stress. It's actually a skill that is reinforced through work.
Yeah, absolutely. And I know I can remember, if you can take yourself back, if you can bear to, those early days of COVID, when there was that sudden shift from everybody working in the office to working at home when everyone had to. And also there was working out, actually, well, what am I going to be working on? What am I doing? And I know for me personally, and I know a lot of other people, one of the big issues that sort of ties into the whole self-agency stuff was around purposefulness and around just thinking, actually, there's certainly, for a lot of people, I think, being a period of time where it didn't feel that people were feeling particularly purposeful because of we were in the middle of that big change. We didn't really know what we were doing. We hadn't worked all that out yet. And so that loss of feeling purposeful was really tough for a lot of people, including me.
Yeah, absolutely. I think you see it's a kind of common trope, isn't it, that it happens with retirement. And many of us will see parents and grandparents retire and then actually find that they've lost something that was quite positive about
absolutely
the work experience. And like day to day, I've been in jobs where I've had emails dictated to me that I'm then meant to type, and that loss of agency over the decisions that happen in your day-to-day life saps so much of your enthusiasm and motivation that it just makes you so much less productive.
It totally de-skills you. Really tough.
And I think, building on that, if we can kind of agree that there's a really wide range of skills and outcomes that are important to building evidence of what works in the workplace, it raises the question of what does, if there's going to be evidence of what works for mental wellbeing in the workplace, what does it even look like? And there have been some, attempts. So one very well publicized recently from the 4-Day Week Foundation, who have tested among 60 companies or something about implementing a 4-day week, which say, most people had Fridays off, and aim to do the same amount of work in fewer hours. And if you're reading that report, it's written very much from the point of view of what's the change in revenue for those companies, what's the turnover in staff at those companies, and lots of kind of organizational, operational challenges and how people dealt with them. And from that perspective, it reads like everybody should do this. They have results like the average increase in revenue was 35% compared to the same period previously. And if switching to a 4-day work week increases revenue by 35%, everyone should do it immediately. But I think what it misses when you measure outcomes like that is it's really the nuance of different workplaces, the pressures and the challenges of different workplaces, how everybody is organized differently. And what that means is it's really, I think, quite hard to produce a piece of evidence that actually everybody can say, oh yeah, everyone can kind of agree, oh, this would work for me as well.
Yeah. I think generally workplaces are far more complex than we realize. There's so much stuff going on in different workplaces that we probably rarely scrape the surface of. So it's very difficult, isn't it, to have a one size fits all.
Yeah, absolutely. And there have been randomized control trials. These are often, they have a group of people that are assigned to one interventional training and a group of people assigned to a different one. There was one comparing physical activity with a kind of a mindfulness intervention, and they're often organized by universities, and almost exclusively they have kind of pretty random take up within organizations, and aren't set up or equipped to be able to follow those people for a long period of time. So the retention rates are often really low. You end up with a couple of people at each organization that you have drop out of 70% or more. And you end up really not having evidence that is able to be translated to different organizations. And if you kind of couple that with what are you even measuring? Revenue is one thing, but I think it requires the buy-in of a whole organization to be able to understand the impact that you're having on the business at that really high level. And similarly to staff turnover, it's really hard to measure that at an organizational level unless you're reaching an entire organization. And I think there's a case. I think we're making a case really that the real outcomes are much more skills based. And those are always going to be quite difficult to measure. So there's a quote here from a report that was written by Demos last year, looking at the public sector productivity gap. And what they found is, when you have KPIs and outcome measures that are based in those kind of short-term hard outcomes, as they call it, the waiting time in a hospital, for example, they're so gainable that you can so easily arrange your service or your organization or your outcomes around making them look good. But it's so hard to actually change the person that is underneath that outcome. And I think that that's the point we're making here, is that what that outcome and what that evidence looks like depends entirely on what you want to change. And what we even want to change when we're looking at workplace well-being, I think, is still something that's not been agreed on. That we certainly think that it's skills-based, that we, our interactions with workplaces and each other are all driven by those core assets. And so measuring them is the thing that should be part of the outcome.
I'm often struck by when workplaces buy in our training, that I suspect that they quite often buy in because it looks great. They think, oh, this is going to be really helpful, and it's going to have some kind of a positive effect. And I think it often stays there. I think where it doesn't go, is quite rare that workplaces will say to us, actually, I want you to come in because I can see from what you can offer that you can impact and you can make this kind of change. This is the specific change that I'm looking for, and I will know that I've got that change by A, B, C, D. That rarely happens. So it often feels as though when people involve well-being type interventions, it's because it's it might be that sometimes I know I'm not naive enough to know that sometimes it might be a tick box exercise, but actually to have that really drilled down clarity about exactly the change I want to make and how I'm going to see that and know that that's happened is quite scarce.
And I think I've certainly never worked in an organization where people have anyone's tracked like my skill development in any kind of quantitative way. So I think that's it's something that isn't. What is measured is how many times did a person quit within a team, which is just the sorts of outcomes that are really so far removed from those asset skill based things that we think we need.
And what are our sickness levels improved?
That sort of thing. And I think it's like Rowan says, it's easy to look at the evidence for what works in the mental well-being, mental health in the workplace. And there's a couple of, the World Health Organization has issued some guidelines. The Wellcome Trust have done a massive piece of work summarizing the literature across a huge number of different areas. And the list of things that doesn't work is endless. And it is lots of things that you might expect. It is mental health first aid. It is like those kind of things that, with a cynical hat on, you would put in the box ticking column of where it's, you know, it's a one-off. You put it there and you kind of hope it stays there, but it doesn't require lots of longitudinal support. But what does work, you know, this is the list kind of assembled from those two reports, are things like setting good boundaries between your work life and your home life, helping people with, you know, peer education classes on work and life skills. That's employees supporting each other, you know, particularly people in immigrant communities, to access services and to understand the function of the NHS, for example, and really helping people to live a good and full and rounded life. That supporting people one-on-one during onboarding rather than giving them a manual and saying, come back in a week when you've read it. Giving employees more autonomy, I think, is one that is, you know, it's summarized in one bullet point here, but it's such a huge shift in culture. So what you know, there was a randomized trial reported on in the World Health Organization where they co-designed the development of a workplace, of a service, the processes within it, and the job descriptions of the employees. So they sat everybody down in a kind of, you know, a week's long qualitative exercise and said, like, what do you want your job description to look like, and how should it interact with so and so's, and like removing that competition between employees and their overlapping job descriptions, and like removing the anxiety that is known to be associated with ambiguous job descriptions. That gave people such a sense of ownership over the whole process of work, as well as kind of you know, as well as the individual decisions that they were then able to make. That's one of the things that has moderate evidence, is actually just finding ways to give people back control over their lives and their decisions.
Going back to our self-agency.
Yeah, exactly. And like, you know, it's kind of, it always makes me think of Little Britain and Computer Says No. And like how, you know, it was a silly skit, but it's kind of, it was indicative of a really frustrating trend. Of experience for all of us when you ring a helpline and they just say like, no, sorry, can't help. But like, so frustrating to be in that situation where you can't help people as well.
And that on the receiving end, it's such a strong sense of helplessness and powerlessness. And I can't do anything about this.
And like, you know, it happens to people in the public sector and in family services all the time. They're just not able to help people because their decision-making ability has been taken away. You know, things like flexible working, being able to work remotely, not all the time, but as needed, is something that gives people some control. That we know, we talked about interpersonal skills and about, I think this again, it's like a really big category of reflective practices, which includes interventions aiming to, you know, kind of mindfulness things, of reminders to take 10 minutes to have a think, or enforcing blocking off some time in your calendar to strategize and to not be, you know, pressured by the constant barrage of emails. Limiting your email use to set periods rather than just having it on and seeing the notification pop up every 5 minutes. All those things to get people to think more carefully and like be a bit more mindful and a bit more reflective in their everyday practice. And the easiest one to implement are reminders to have a walk around. But the, you know, really the other broad category of what works is how these are all implemented. And I think so central to that is buy-in from a big enough section of the team and good leadership. That, you know, it's fine to say, I have an open door policy. You can come and tell me about any mental health problems you're having. But unless you see people doing that around you, and unless you see senior leadership doing that, I mean, it doesn't stick.
Yeah, yeah. It's the old style equivalent of having a policy that's just kept in the filing cabinet, isn't it? It needs to be enacted. It needs to be living and breathing part of the culture of the organisation.
Yeah, exactly. Yeah, exactly that. And I think, you know, we have some of it here. It's seeing your senior leadership team taking time off in lieu because they've worked an extra hour one day.
Yeah.
It's so enabling to everybody else to then be able to do it.
Yeah.
And that's like a very practical example.
Yeah.
But yeah, similarly, just hearing somebody else at work say, like, actually, I'm anxious about this. Can we, can you help me with it? It's just so, it's such a different way of working.
Yeah.
And I guess that's kind of these are all the reasons why it's so difficult. That, in order to improve the emotional health of employees, you need to have an understanding of what that is, why it's important for those individuals and for a business, and to, I think, crucially understand how to measure it in a robust way that takes into account what those individuals need, what the business needs are, and then to have the leadership in place to be able to actually enact those, and to model it for other people.
I think looking at the that bottom point about key workplace outcomes, there's something about, for me, around thinking about that balance between individuals' needs and about organisational needs, and I think there's quite it's not that difficult to look after people and to make sure that they're happy and that they're fulfilled and they feel cared for. I think the reality is that's quite hard to do in the context of an organization who has to deliver outcomes and to deliver targets and has got its whole business to carry on and do. So I think quite often people can be quite glib about that, and but it's actually quite a hard thing to do. And I think it is worth remembering that although clearly as an organization we feel it's absolutely crucial that organizations look after the emotional health of their team and their individuals, it's also really important to remember that all of that needs to be done in the context of the nature of the agreement. That then the agreement is that there's a contract which is between employer and employee, and there is the expectation that employee will deliver outcomes and is there to serve a purpose. So I think those two things there's often a tension between those two things.
There is, and I think it's a tension that becomes more comfortable when you think of it as you're exchanging your time for money and your skills, but you're also getting in return consideration of your skills, rather than an expectation that your employer has a duty to maintain your mental health.
Yes, absolutely,
Yeah.
So there's a whole other discussion that could be had there about expectations and what are different people's expectations of their employer. And I suspect amongst every organisation there are quite often some subtle and some obvious disparities between employees' expectations and what their employer will provide for them.
Yeah, exactly. And I think nobody wants it to be their first line of support when they're experiencing mental ill health to have to go to their boss, and I think it's what they want is actually some support to not get there. Not be there in the first place.
Absolutely.
And so I think this is our approach to how we evaluate our trainings, is that we acknowledge that nobody knows what the answer is, the best way to improve mental well-being, or necessarily the best way to measure it, and that the short-term hard outcomes are the easiest to measure, but they're probably the least informative if you're thinking about mental well-being and emotional health and what works in the workplace from kind of that skills perspective. But what we do know, and that we've published recently, is that when those interactions with the workplace are skills-based and positive and reinforcing emotional health, that those ripple effects go out from that employee-employer relationship into the wider world. This is what we do. We use a series of validated tools. So when we work with workplaces, we ask people to track longitudinal changes in empathy, self-awareness, how communication happens within an organization, as well as looking at the kind of culture as a whole. We have tools in-house that we use to measure what we think of as emotional health. And really, where it's possible, we ask that there's a kind of qualitative component to it as well, to understand what it is that businesses want to change, and how to get there, and people's experiences of the process and of that employee-employer and staff-to-staff relationship.
Yeah, so just wanted to share how we support workplaces specifically, and I guess we feel that actually our offer is quite way beyond the standard wellbeing in the workplace offer, which tends to be either wellbeing, which is, might be things like, dress down Friday, free yoga once a month, discounted gym access, etc., which are all great, are all really, really good things. Of themselves, they're probably not going to transform the culture of an organization. And I guess the other end of that is the mental health intervention. So I think you mentioned mental health first aid earlier, Robin. So those often mental health interventions in the workplace are often around training senior leaders and managers to be able to spot signs of any mental health problems or challenges that staff might be experiencing, and being able to support them or signpost them in that. I guess we feel that we're much more early on than all of that. So we feel very much that we are around, we've used the word skills a lot, we're around skilling up organisations. So we're around actually skilling up, giving staff the strategies and the tools and the skills that they need to be able to manage the ups and downs of everyday life at work and avoid those mental health crises and having to go to their manager saying, I've got a bit of a problem here. And obviously, if we're preventing all of that stuff, it's going to be helpful for everyone. It's going to be helpful for individuals as well as workplaces. So as that bullet point makes out, we're very clear that we're not about firefighting. We're actually about putting things in place so that actually the fires don't start in the first place. Going back to that protective factor as well. And I guess lots of knock-on effects outside of work, although that workplace offer is focused on the workplace. Because we're talking about people and people's lives and people's skills, that has impacts on people's families and their relationships outside of work, which in effect, again, also has knock-on effects back into the workplace as well. So you get that really positive cycle going on. And very much our training offer is around the support of Robin and his team in impact and evidence, about working alongside people to do those very things that we've highlighted, which is around helping people to identify what change they want made and what the best ways of measuring that might be. I guess ultimately our training offer, there's something about what we want to do is we want to create a culture of care and empathy which enables both individuals and organizations to be able to thrive. So it's, it's a win-win all round, really.
It's good. You should write that down.
Should write that down sometime, shouldn't I? And on practical terms, this is what our training looks like for people. We offer an Emotional Health in the Workplace Foundation Day, which covers lots of those, some of the areas we talked on, lots of things around that are followed up in those follow-on half days in a bit more detail around managing. All of this is through an emotional health lens, because there's a lot of stuff out there about managing stress and managing change, but our stuff is specifically around through that emotional health lens, really. I won't list all of those. But one of the other options that we're really keen, the more we can work in partnership with organisations, we feel that that's more helpful all round, really. The more longer term partnerships we can develop, the more we're able to offer bespoke training options for people, and much more tailored to their needs, but also extend some of our other offers, such as, for example, training staff to deliver our parent groups to the parents who are within their organization. So there's a whole range of stuff that we feel that we can support organizations with if they want to make that change. And there is my email address if anyone would like to have a further conversation about any of those training options at any stage. Really happy to chat further.
Thank you. We'll stop sharing slides. I see a little red dot next to the Q&A. Magnolia, are you going to ask us questions?
Hi, yeah. So there are 2 questions in the Q&A. And if everyone else wants to ask anything, feel free to pop your questions in the Q&A or just raise your hand and unmute. But the 2 questions we have are, what does giving employees more autonomy look like in day-to-day life? And how can organizations measure the success of well-being programs without falling into the KPI trap?
Good question. So can you repeat the first one again, Magnor?
What does giving employees more autonomy look like in day-to-day life?
So that's employees, more autonomy. Yeah. I think that question proves a really good point in that it's not a one size fits all that we said earlier. I think it's a really boring answer. I'm afraid that it's not going to give a definitive answer, but I think it depends so much on the nature of the organization, on the nuances of the team, what the intended outcomes are wanting to be.
Yeah, I think that's certainly that's the kind of the broad answer is it's not prescriptive, right? And the examples of what's been tested and shown to work is that giving people autonomy over what they have autonomy over is step one. That letting people have some input into what it is they're doing and what it is that they get to decide is helpful.
Yeah.
And that it can look like a kind of workshop exercise like they've explored in various trials, but it can also look like exploring what the kind of team strategy is as a group. So we, an example from our own work is we have a strategic plan and we get together regularly as a team to review that strategic plan, which was, as before I joined, but it was kind of drawn up as a team.
Yeah.
And it is reviewed and the kind of finer detail put around it as a team so that people actually have some input into the things that they will be doing.
And I think there's something key about that idea of the co-creation of things, not just in plans, but I think the more involved for me on a day-to-day basis, what it looks like is involvement and empowerment of everybody, and that might be co-creation of team meeting agendas. It might be decision making about what we're going to do for our away day. It might be lots of strategic stuff, because we know that the more invested people are, actually the more helpful that's going to be. People are going to feel more purposeful. That's going to benefit everybody. It's going to be win-win all round.
Yeah. And the kind of, I guess, like the slightly glib answer is like, avoiding micromanagement. But what that means is, through an emotional health lens, is, it's having good beliefs about the people that you work with and trusting them to do work without, minute to minute supervision.
And I think crucially, there's something about levels of autonomy. I think there's something about knowing each individual well enough to know the level of autonomy that they both want and feel comfortable with, because it's quite easy to fall into the trap of giving people too much autonomy that actually is not helpful for them, because actually they're fazed by it and they're freaked by it and not equipped for it. So there's something about individualizing it all that feels crucial as well.
And like a culture where somebody can come to you and say, actually, you've asked me to do this, but I've got no idea what you're talking about.
Exactly.
And it's making sure that culture is there, and that culture comes around by us doing it first. Our manager doing it first.
Yeah.
What was the second question?
What was the second question?
The second question was, how can organizations measure the success of well-being programs without falling into the KPI trap?
So I think that there's a lot. My answer to this, with an academic background, is kind of always going to be through a bit of an academic lens, which is that if you take kind of a psychology and a workplace psychology hat on, you can think about all these kind of emotional health skills through that lens. And there are lots and lots of validated tools that have been shown to correlate skills-based outcomes with kind of workplace-based outcomes. And so there are tools that you can use to measure, often kind of referred to as emotional intelligence in the workplace, to get an idea of the culture. Or kind of more specifically, or maybe more up our street, is things like, communication skills and understanding what that looks like and what people feel comfortable using and what they use on a day-to-day basis.
So we have 2 more questions as well. What are some practical ways employers can help employees develop self-belief and relationship skills in a professional setting?
Yeah, I think there are ways that you can do that in terms of looking at some of the trainings that we do, which might be looking at practical examples in the workplace of some of this stuff that might feel a bit intangible otherwise. So just I think being really concrete and looking through specific examples of actually how you might want to improve those communication skills. So it might be with fellow team members, it might be with customers or service users, and equipping people with tools and strategies, which is certainly one of the things that we do, to enable people to be able to do that. Mackinac, can you remember what was the second part of that? Because there's another part that I've just lost. I wanted to address as well. Can you just say that again? Was it
Self-belief and relationship skills. So how can employers help employees develop self-belief and relationship skills?
Yeah, sure. Yeah, that's it. There's something there around. We can do all of that stuff. We can do those specific skills and strategies and equipping people with, what people often call a toolkit and a toolbox. However, all of that needs to happen within the context of the culture of the organization. So I think there's something about it needing to be alongside those two things. It's skilling up people, but it's also thinking about actually what's the culture and the climate of this organization, so that those ways of communicating and relating feel in sync with the rest of the culture of the organization, which is where I think sometimes people fall down, because the skills thing is quite a practical thing and the culture is a bit more of a long-term thing to do, but they need to be symbiotic and they need to feel natural with each other, is what I'd say.
And another question was, what advice do you have for employees who want to advocate for more workplace well-being initiatives in their workplace?
Send your manager a copy of the recording of this webinar. Yeah, it's a good question.
I mean, I'm immediately thinking, I think my advice would be, think about what you really want, what you really mean by that. So specifically, what do you mean by it? And as we go back to our earlier conversation, what do you want to happen? What do you want either to maintain, or what do you want to be differently? Think about what you want to change, but specifically. So I think something about being really clear about why you want that.
I think that's good advice, isn't it? To understand what the impact would be on you as an individual and on the team and on the business or the workplace setting. The understanding, kind of how the skills approach to all of that would actually benefit everybody, like what the outcomes are. I think that's the thing,
I think there's always a good question that I often, people here sometimes get a bit sick of me saying, that I'm often asking is just, okay, to what end? For what purpose? So just thinking all the time about, okay, so just being thoughtful about what the reasoning for this is.
Yeah, like, if it's because lots of people are stressed or you're stressed, then I think actually just being able to phrase that in a way that is constructive, I think is good.
Yeah.
And just recognizing it and saying it.
Yeah, absolutely. Yeah.
And one question which is really interesting is, how do you decide what the right outcomes are?
I think is that, as Rowan just said, it's going to be bespoke to you and your setting. I think there's lots of approaches you could take, and you can read lots about it. The lens through which we view it all is that skills-based is the right way to do it. Other options are available, but I think it's going to be what fits, what is possible within the realms of your own workplace and the people that you work within yourself, and what you need, and what your workplace needs are. If they're driven by particular outcomes that you need, like sales or staff retention or quality or whatever it is, I think you have to have a discussion amongst yourselves. I don't think it's.
Well, I was just thinking also, go back to the whole premise of this webinar. There's something about the outcomes that you want are they're not to send people on a training. They might be to send people on a training so that we then can see this change, and we will then measure that, and that's how we will get the outcome.
Yeah, I think it's not a question that has an easy answer. I think it is think long and hard about what it is that you need to change. Oh.
Yeah, those were all the questions in the Q&A.
Great. Well, we will end it there. Thank you so much, everyone, for coming along. If you've got any questions, feel free to reach out by email.
Great. Thanks, everyone.
Thank you.
Bye-bye.